So I see that it's 10 o'clock, and we want to welcome you all to our latest uh, episode of Let's Talk About OMM Research. This will be an update from our directors, uh, and we're happy to have all of you with us. Just a couple housekeeping items. So at the bottom of the screen, you should see there is a Q&A, question and answer, and there's also a chat. So we would appreciate if you would use the Q&A if you have questions during the presentations, so that we can answer them. If you would please type in there the name of the person you have the question for, as you write the question, just so we can make sure we keep track of that, of who the questions were directed to. And the chat, if you have any technical issues, if you'd please use the chat for those. So if you can't hear something or something like that, please use the chat for those. There is also, we will have at the after the presentations from the directors, we will have some time for discussion, and we'd like to hear from all of you. If you're willing to speak live, that would be wonderful. Otherwise, we'll ask you to put discussion into the Q&A. So without further ado, I will do what I can to do this right this time. Share the screen here. And hopefully everyone can see that okay. And so, as I said, this is our 4th episode about Let's Talk About OMM Research. What we have done this time is we have pre-recorded our director updates, and then we'll answer questions live. So our first recording here is a director update from our director, Brian Degenhart.
Good morning, good afternoon, or good day to wherever you are. For this program, let's talk about OMM research, DO TouchNet's 4th episode of our new series. Today is our winter quarterly update on our activities and plans for the upcoming year. My name is Brian Degenhart. I'm the director of the Research Institute. And first of all, I'd like to wish everyone a happy new year from around the world. And our membership is from all around the world. We now have over 730 members throughout the world. Almost 400 of them are in the United States. Over 150 of them are in Germany. About 110 are in Brazil, and 69 are then distributed to other countries throughout the world. So I want to welcome all of you to today's program. Last decade, our goals were to establish the network and to engage membership primarily in research, and to help bring them into research by engaging membership at annual meetings and providing continuing education. Last year, our annual meeting was held in Colorado Springs with the American Academy of Osteopathy. Initially, we had our annual meetings here in Kirksville, but to try to increase engagement of membership, we moved that to just before the Academy meeting. Last year, it was at a very unusual time. We can see here that last year with the onset of COVID, that at the time of the American Academy of Osteopathy's convocation, the pandemic was just beginning to involve the entire world on very significant levels. And we can see the increasing rates of infection just beginning to skyrocket at this moment when our annual meeting occurred last year. After going through a couple of weeks of quarantining, having been at that meeting, as a clinician, I was required to continue seeing patients on an emergency basis, but basically no faculty, staff, or students were able to come onto campus from April into July. During that time, many policies changed on what have now become our usual activities, with wearing face masks, maintaining social distancing, having screening every time we go into the building. Here, one of our mannequins was even screened to make sure it did not have a temperature before joining the university community. In January, 1 year ago, this is what our manipulative medicine labs looked like. When we opened up the program again in July, that same room had to be simplified to this type of scenario where we only had a few tables. All students wore masks and gloves. We had to then take another set of tables into our gymnasium and turn that into a training area. We are only able to have a quarter of the class in both of those rooms, so we're teaching twice as much and in a very unique fashion. This was our research institute in 2019 when a German film crew was there to look at the work that we do with objective models to help with the development of accurate palpation skills. And now we have plastic curtains between each row in order to try to minimize the amount of airflow that could cause the transmission of the virus. And students are wearing masks and gloves also to minimize that transmission. Unfortunately, we've been very successful since July in significantly minimizing any transmission of the virus. We were not able to have any continuing education programs, particularly our Advancing Skills in Osteopathy program. None existed in 2020. Even our Founders Day program, which has gone on since the 1920s, occurred primarily virtually, and we had a drive-through where people could have a brief interaction with various members of the university. So 2020, in our goal of engagement at annual meetings, continuing education, was very difficult. And that was also true for research. And through this year, we've been primarily working on developing and testing electronic data system in preparation for establishing an osteopathic manipulative medicine patient registry. And so then came 2021. And although there was a variety of fanfare, it was very, very different in how people could actually participate. And while the numbers that looked very bad in the early 2020, back in March and April, and that I showed you earlier, it does not even compare to what we're seeing now. Those earlier graphs occurred with the rate of infections occurring at this time, and we can see now that it is far beyond any comprehension that we might have had a year ago. So how are we going to address our goals for 2021? We certainly want to increase the engagement with our membership, and through annual meeting, continuing education, and research. So what are our updates? So the annual meeting for the American Academy of Osteopathy, occurring in March in 2021, is actually going virtual. That decision was just made 2 days ago, and so there will be no in-person conference. As a result, DO TouchNet is going to become a gold sponsor at the virtual convocation. And so each day we will have special programming for our members to join us in. As you can see in today's activity, we've already established monthly programming to bring membership together. Part of it is to keep you updated on a quarterly basis like we're doing right now. And on the other 2 months, we will have an educational webinar and a journal club to help continue to increase our understanding of the work that we do, preparing us for future research, and increasing our knowledge of the evidence associated with manual therapies. We are continuing to prepare for the launching of the patient registry, which Jane Johnson, the Associate Director, will be updating us on in a moment. We'll continue to be working on publishing completed studies, and we are working on a new initiative within the A.T. Still Research Institute, which is the International Congress of Manual Therapies. The International Congress of Manual Therapies is an organization whose goal is to bring together interprofessional clinicians and views around manual therapies, along with scientists and evidence about the neuromusculoskeletal systems and the circulatory system, to build an ongoing platform for premier research and collaboration within the fields of manual therapy. Our inaugural conference was supposed to be in May of 2021, but has been postponed to May 6th through the 8th, 2022 in Phoenix, Arizona. And we will be giving you updates on that throughout this upcoming year. So with that, I would like to now pass on the platform to Jane to give us further updates.
Okay, so, well.
Good morning.
Oh,
good afternoon.
There we go. Okay. Greetings, DO TouchNet members. I'm Jane Johnson, the Associate Director for DO TouchNet, and I'm grateful to be here today to share some of our research updates with you. So we'll start with just a quick reminder here about that research is our mission and our purpose here at DO TouchNet. Our official mission is to evaluate and advance the practice of osteopathic manipulative medicine. And our purpose is to create and sustain a network of clinicians engaged in the assessment of the clinical usefulness of OMM. So to that end, I want to give you an update about what we've been up to and what we have planned. So let's start from the end of the research process. the dissemination phase. We currently have 2 manuscripts in process. The first one on our patient-reported adverse events from OMT study that was conducted in collaboration with the regional center in Germany. We are in the final edits on the draft of the manuscript, and we'll be submitting that manuscript for review in the very near future, hopefully in the next couple of weeks. And then we have started drafting our next manuscript on the study on the use and effectiveness of OMM in the clinical setting. That manuscript will focus on the effects of a single session of OMT on patient-reported outcomes, looking at symptom severity and quality of life measures. So we're excited to be so close to getting one of those ready to go and moving along quickly on the second one. As Brian mentioned, we have the upcoming ICMT conference, and one of the things that we are wanting to contribute is about the categorization of OMT techniques, as we fondly have called it, the technique of the month. These were the videos that you all helped us to discover how we were doing on defining techniques and being consistent in what we call them. So that data collection is completed, and we're in the process of analyzing it. We will be in the very near future assembling a working group to examine the results from the technique phase 1 of the technique of the month videos, and to examine those results, and to examine the definitions that we have been using for OMT techniques, and propose revisions to the categories of techniques and or the definitions, how we define the techniques. So we will be sending out a call for those who would be interested in participating in that working group. So keep your eyes open for that. After that is done, we will be conducting a second phase of the Technique of the Month videos with the new categories, definitions for the techniques, and to see if we see any improvement. As far as the dissemination part, that working group will be tasked with producing a paper describing their deliberations and conclusions. So if you're interested in that, keep your eyes open. Another project that's in the dissemination phase is, you may recall, we sent a survey out about what the effects of the COVID-19 pandemic have been on your practice of osteopathic manipulative medicine. We had, as I reported in our October update, We had 139 respondents, which is 20% of our membership. We are in the early stages of analyzing that data and we plan on producing a rapid communication about those results. Based on that, we have restarted one of our research projects in the United States only currently, and that is the documenting the use of OMT to treat patients with COVID-19. You may recall seeing this graph. These were our weekly summaries of how many patients had been treated with OMT who had a diagnosis of COVID-19. This was started in March, and we discontinued at the end of August, in part because we weren't seeing a lot of patients treated with OMT who had COVID-19. Based on the increased cases and hospitalizations in the United States, we have restarted that data collection only in the United States for now. That is, for those of you in the US, you'll be receiving your last chance next week to sign up to participate in this data collection, and so we can see how hopefully how much OMT is being used to treat COVID-19. The follow-up to that study, if we have enough sample size, big enough sample size, is that we would like to conduct a study looking at the clinical markers for COVID-19 patients treated with OMT. So does OMT reduce hospital stay, mortality rate, ventilator use, things like that? So if you're up for participating in that weekly summary, it's just a simple, how many patients did you see in the last week that you treated with OMT who were diagnosed with COVID-19? If you're up for that, please sign up for that. In the development phase, we've spoken previously about the Osteopathic Manipulative Treatment Effectiveness and Safety Patient Registry, or OSPREY, as we call it. Just a quick overview. The long-term objective of this patient registry is helping patients and healthcare providers to make informed decisions about OMT, whether it would help them. Quick summary: we'll be collecting, background data, data about patient problem severity and quality of life preceding OMT, and then after OMT. In addition, after OMT, we will be collecting information about side effects or potential adverse events. So continuing our work both in the effectiveness of OMT and the safety of OMT, and also building a large data warehouse that we can make available for people who have specific research questions that can be answered by the data we're collecting here. So we're busily trying to get ready for our beta testing. We are starting this in the United States with because of data protection regulations in various other places, like the European Union. It will take us a little longer to get started there. There are, but as you'll hear from Marina, we've been working with the German Regional Center to try to get that moving forward. The beta testing will be coming up in the next couple months. We will be recruiting 5 to 10 clinician champions in the US who are willing to have 3 to 5 of their patients try out the Osprey system. We'll do a condensed version where they do everything over a 3-day period, first for the beta testing. And after we get feedback from the patients on that, then we'll follow up that with a second round of beta testing where everything is done in real time. The questionnaires are all sent in real time, and get feedback from that, from the patients and the clinician champions. And based on those recommendations, suggestions, we'll be releasing Osprey in the United States starting in April. And following that, we will be hurriedly trying to get together the information we need so that we can also release it in Germany and other places. So those are my updates for today. Thank you. Such a smooth close there. All right. And then we have a brief update from our regional director in Germany, Marina Fuhrman.
Hello everybody, here's Marina Fuhrman from Germany. First of all, happy and healthy New Year to everybody. Unfortunately, I cannot join today's meeting, and so I sent you my message by video. Regarding the questions, what were our DO-TouchNet topics 2020 in Germany, I will give you a short overview. By the aim to spread out the Osprey study to Europe, first in Germany, we started preparing the material of the Osprey study. Therefore, we checked the comprehensibility of the question at the end of February 2020 and made the preparation for this translation. At the end of July, we sent the final translation, including the double check, translation from English to German and from German to English by another person. Pre and post OMT sheets, questionnaires, email invitation, and the informed consent. In September 2020, we got the last inquiry from Jane regarding the Osprey work. Meanwhile, we reported about our activities during our DO-TouchNet online meeting in October 2020. So I hope you and your colleagues are doing well. Stay healthy, and bye-bye from Wiesbaden.
All right. So unfortunately, Andre was not able to join us, our regional director from Brazil. They are currently working with us to produce, start the osteopathic manipulative treatment patient-reported adverse event study there, and so we're getting very close on that as well. So, so now we'd like to hear from you. You know, an update from our members. You know, how are things going for you, and what do you think that your, because this is your practice-based research network, what do you think about our plans and activities? What should we be doing together as a practice-based research network to engage with each other? And what can we do to fulfill our mission? Brian, do you have anything to add to that? Nope. Okay, so if anybody is willing to speak to that, we would be glad to hear from you. Okay, so Marcus has his hand up. And we would, since we would like everybody to be able to talk, to have a chance to talk, if we can, you know, keep our comments to a couple minutes, that would be great. So, Marcus?
Was that a comment just for me now?
No. No. It's short memory. I was going to say that.
So yeah, let me just start by wishing you all a happy new year too, and hope you're all going to stay as healthy as you are right now, and nothing changes about that. So this is, I think, goal number one for 2021. And so my thoughts, first of all, are you are doing such an amazing job, and I could not be prouder to be part of what we do together. You know, you said like this is our network, but without you, where would we be? I mean, you are the brains and the hearts, and we are maybe your vital organs, and we produce some informations that might be interpreted by the brain, but without that, that would be all for nothing. So thank you very much for all the work you do in Kirksville, for everybody around the world, actually. So thank you for that. And I think what we could all do is first of all participate in the things you should suggested, and produce some interesting results, and publish them and take them out into the world to see what osteopathy can provide for people all around the world seeking better health and whatnot. And so that would be the first thing, right? To actually contribute. And I think that happened before and should continue to increase. And maybe it needs to be more known. I think this is maybe still an issue, that DO TouchNet does an amazing job, but is it already as known as it could be, you know, from a physician standpoint or from non-physician osteopathic standpoint. So there needs to be maybe more visibility and maybe more getting in touch with a younger generation that is maybe more willing to try out something new or is more energetic about that. So maybe the social media topic might be something that could be played into and could help to further our all our goals here. That would be my idea in this case.
Wonderful. Yeah, well, I thank you. We certainly appreciate the thoughts and yeah, trying to figure out how to work together.
Yeah, so if I can ask you a question, Marcus, in following up with your comments, I'm just trying to think of what would be really easy to really engage all members. And there are formats called card studies where you just put a very small amount of information down and about, you know, what's ever going on in the clinic. And we really have not ever quantified just, you know, how many people do people see in a day or in a week, or what types of conditions across the network. We've had clusters of members participate on that. But do you think it would be realistic, especially using these technologies that you've mentioned, to try to engage, you know, some of the younger members as well, to look at something that would be just purely descriptive, that they can look over, you know, the past week and just tell us how many patients did you see, what were the types of conditions you saw, you know, just some demographic data to really describe, you know, what's going on in all of our practices, because right now we are pretty limited in knowing that.
Yeah, sure. I think that would be very interesting, because what connects people in a way is that we always think like we are super alone with everything that happens to us, because we are somewhat isolated in our thoughts, and maybe seeing that, in other clinics they treat the exact amount of patients as I am, or we see a decline of number treated because practitioners are exhausted or I don't know, but to see what's happening and get some interesting information out of it might be actually something that's useful. And what I see, maybe that's not exactly the same, but this is the thought that comes up when you say this, is on social media, for example, infographics are something that's super, that's very interesting, because you see like information worked into a graphic. So it's easily consumable and understandable, and makes maybe a difficult topic easily understandable for somebody maybe who was never in touch with anything scientific before, and seeing, oh yeah, this relates to me too, and maybe this is interesting for me to participate in this network too, because I don't need to have a scientific background, but I can contribute something to it.
Yeah. Excellent. Thank you.
Thank you.
On the, I see Sergio has his hand up.
Can you hear me?
Yes.
Okay, thank you. First of all, like the former person before, I forgot his name. Sorry. I wish you a fantastic 2021, happy new year, safe especially. And my concern is to treat. The news are speaking only about the acute phase of COVID-19 patients, but no one is talking about when the patient has survived, what he has, what are the lasting problems that he's living when getting home. So what I mean, I have some patients who had COVID-19, and after that they had such tiredness and back pain without working, but being still active, and they were young. Well, the oldest was 52, and the youngest 35. So I think it is important that we see what we can do to, like, you know, when you buy a car and is post-sale service, that we can see how we can manage this compensation that occurred to these patients during after the COVID-19 acute phase. You know, I don't know if you can that mention like a chronicity, because it is lasting over 6 months. But then sometimes in these 6 months, it is not only a small pain, it is associated with some phases of acute pain, and this without any movement. That was making my concern when I visited these patients in my practice. I was astonished to see the unique cause they had before. It was that they had once the COVID-19, 2 weeks or 3 weeks before. But is it maybe because they were lying so long in the bed and they were ventilated to get some oxygen? And is this COVID also not only affecting the lungs, as we know, everybody, but different organs, and the nutrition of these organs are concerned too, and it becomes a big issue for the body to optimize his homeostasis and to keep the body in a normal physiological state. I know that was a lot of information, but that was only the package that I gave. Now my question is, we could because we here in Luxembourg where I live, I don't see patients in acute phase. They are transferred immediately to the hospital, and there we have doctors who do their best, and it's fantastic. But once they have done their work, they're happy, doctors, what they have done. But there is a part of the patient's health which is forgotten, is the musculoskeletal system, which is an expression not only for joints problem, but also for visceral problem that can occur during the phase of COVID-19 disease. Was that enough clear?
Yeah.
Okay, thank you.
Yeah, thanks.
But it is not easy to launch a study about it, because there are also ethics purposes for that, especially about the COVID-19 is a new pandemic, and so we have to treat the patient to that they survive. And we also, part in Europe, we are not medical, so we cannot provide medicine or whatever, and we can only treat the musculoskeletal system. So we can only treat them after, when they come back from hospital.
Yeah, thank you,
Right.
Sergio.
You're welcome.
Yeah, and I think the discussion is very appropriate. And I want to give Dr. Devine a chance to talk, if he would like to, about the work that they're trying to get started in Arizona, because really this is a factor of COVID that we have not even considered looking at. And I think this is really relevant. So Bill, you want to take it from here?
Yeah, thank you, Brian. This is Dr. William Devine. I'm a professor at Midwestern University on the Arizona campus. Hello to my colleagues in Europe. I presently am immune now to the COVID-19. Apparently, I had a titer that was positive after convocation, and I have completed my vaccinations, the Pfizer vaccinations, and have had a very positive exposure to it. And fortunately, at age 76, have not come down with it. So I'm doing very well. I bicycled 2 miles this morning, very healthy. I have a colleague, one of my residents, former residents in neuromusculoskeletal medicine, is practicing on the Navajo Reservation, Native American population in northeastern Arizona. He has a small clinic of Native Americans that have a very high risk. We lost about 300 Navajos this year, or actually more. But his population are post-COVID syndrome patients. And he has used the protocol, which includes a proper sequencing that we worked on when he was a resident, treating simultaneously the lymphatic system, the Chapman reflexes, but also cranial manipulation. The sympathetic division drives a lot of the immune system. Sergio mentioned the upper thoracic tightness, which is really common. That's a viscerosomatic reflex causing that, some hypoxia. So what you're having is a patient that has brain fog, that may actually have a myocardopathy, may have some permanent or nearly permanent damage to the alveoli. He mentioned a population of younger people that have this, not as being the majority of his. So he has recorded a video, a very first class video there in his office. And then I have another person who is my present resident, who did the last 7 weeks of her residency in family medicine. She's now neuromusculoskeletal medicine. She treated patients on the ventilator for 7 weeks. She volunteered for it, had to sign her life away for it. And she is going to present how she treated the post-ventilator patient, or excuse me, the ventilator patients. I have a protocol that I worked up for the ones in the early stages. Of course, you want to keep them off the ventilator. She did not lose a single patient on the patients that she treated, which is a little different than our statistics. So we hope to have this completed by next Friday. It'll be a video tape. I'll send it on to Brian to look at, and then he can send it on internationally. But in this, I tried to do a series of 11 steps that could be used similar to the MOPSI study, very similar, but it's in a sequence. The techniques actually will treat the Chapman points, which some of you know, with Dr. Kuchera and Dr. Fossum wrote a chapter on Chapman's for a Foundations book. The Chapman points are included indirectly in the fascial release portion of this technique. So it may be of interest to the community, and it is certainly helping the patients on, let's call it an early pilot project of necessity on the Navajo Reservation right now on the post-COVID patient. It'll last about 3 to 6 months, hopefully, on a lot of the patients who've had a rough go with the COVID infection. The brain fog can be treated with basic cranial, including just the CV4 technique. But you also have to affect the lymphatic system and to take down the inflammatory aspects. So all of this is explained. I'll get it to Brian. I'm sure it'll be of interest to our group. So that's about all I have to say. Are there any questions from the panel?
Well, thank you, Bill, for bringing that up and really highlighting, the scope of this problem that is just beginning, and the role that osteopathic approaches are going to have to this. Many people have not been able to care for the people in the acute phase, but when we have the chronic phase, clearly they're going to be looking for answers, and there's not going to be any significant answers in traditional medicine, and they will be seeking for this type of care. So I think we just have to figure out how we can empower the network to identify these patients, identify the changes in their experience of their symptoms, and the work that's done, the duration of the symptoms that occur as a result of treatment, because that will provide data that then can be compared to a lot of other groups that will not have access to a manipulative medicine approach. So I would love everybody to certainly think about this and to outline, what things should we be collecting in a very simple way as we ramp up and trying to care for these people with this post-COVID syndrome, which I think is probably going to be a name that will stick, because it is very evident that it is a multi-system syndrome. So thank you for those comments, and I'd love people to keep working on this, bring it back so we can put together a system that we can kind of disseminate throughout the network. Any other comments or questions on that? Is there interest from the other people online to be heading down in this direction?
Shane Patterson has his
There we go.
hand up.
Yeah.
Hey,
Got it. Yeah.
I'm just going to say real quickly, I appreciated when Bill introduced himself. So if everybody would give a quick introduction of themselves when they talk, that would be great.
No. All right. Yeah, sure. Yeah, I'm Shane Patterson. I'm a DO in Southeast Michigan. I own a practice here, and internal medicine board certified, but about 95% of my practice is now OMT. And we're doing very well during all this, intriguingly. So in our group and with our provider organization, we've kind of been taking surveys to how people are bouncing back from the COVID. And this is more from a business perspective, but I think it applies fairly nicely here. Most of the family practice and primary care clinics are still down about 30% around this area as far as patient volume. Intriguingly, our OMT side of things and our searches for specifically OMT on the internet have about quadrupled in the past 4 months. My patient load is almost doubled in the past 5 months. In fact, I'm still looking for other physicians to practice and do more OMT here. So from that side of things, it appears that people are looking more for the preventative concepts. They're looking for more of the holistic, more of the what can I do to keep from getting sick concepts here. Because most of the searches that they're finding on our servers are not just general pain stuff like I used to get, but much more holistic, much more health related, much more things like that. And so they're looking to us for that sort of guidance also. So it's not just the OMT side, it's also the philosophy side of osteopathy that they're really seeming to get more interested in. So that may be another avenue we want, and other practices may want to kind of push that on their websites, or advertising wise may want to kind of skew towards that side a bit also. And that's just an experiential issue from my side of things. Thanks.
Okay.
Yeah, thanks, Shane. Okay, so we have about 5 minutes. So we want to give everybody, once again, this is how we want to engage membership. This is an important time to hear your questions, your insights to help kind of direct the network. So any more comments about COVID or any other ideas you may have?
Do you hear me?
Yes.
Yes.
Yes. Sorry. My name is Sergio Marcucci. I'm a DO and doctor in health science. I'm working in Luxembourg. As I mentioned before, the post-COVID syndrome problem that we have to treat here in Europe more than maybe you in US because you are a physician. And Brian, you said something very important before. You asked how could we, all the groups from DO TouchNet, gather information about this COVID-19 post syndrome. What we could do, maybe a sample for everybody, organize a sample, which it has maybe 10 items. And when we have a patient with a post COVID-19 syndrome, we ask before the patient to tell us his history from the pain, and then we could record it on this sample. And once this sample would be completed, we could ask the patient to sign it, that he agree or she agree that we deal his information or her information with the DO TouchNet for the science. Without, of course, without a name or surname from patient. That would be, and then we, everybody here from us, we could send it to Jane and to you, Brian, and you would then have an amount of information, and then we could maybe start to do an algorithm, because we would have a lot of information and spreading information, and it would be like a forest, and we want to see the small tree inside the forest. So the important information.
Yeah.
Yeah, so to pursue that, I would recommend everybody, if you come across an article that kind of lists out symptom complexes after having COVID, and maybe even after having the vaccine. I mean, there are, potential that there is a artificially induced post-COVID syndrome that once again, these are the people that will often seek out our type of care, because a lot of people will not have, options to give them. So try to identify sources that list out the common symptoms that people are recognizing at this moment. We will try to construct that into a simple survey or questionnaire that could be easily applied within your offices or clinics, practices. And we'll have a section where they can add just their unique symptoms, which may not be recognized at this time, but we may end up finding that it's a very real, issue associated with the COVID, post-COVID syndrome. So if you find any of these documents, please send them to us. We can help facilitate putting together a survey, a template for that type of collection. And that will be something that if we have interest and we can pull together this, that may be something we can implement in 2021. Kate?
Yeah, hi, I'm Kate Warden. I'm also in Arizona, colleague of Bill Devine. And Happy New Year to all. I'm listening to this and it's very sad for me. I had to retire from seeing patients in the clinic because of COVID and my high risk status until we can get a change. But the vaccine is coming, and I'm hoping to return to patient care. I don't know how much I'm going to be able to be useful in that sense as not being a clinician to the network, but I hope to continue with just my history and information that we have and research to be part of the network. So if you'll have me, I'll still hang around.
Yeah, Kate, this is a home for you for sure, and certainly, there are roles within the network that go certainly beyond patient care, and so I just tried to explain, finding literature that helps to lay out the scope of what we know about a post-COVID syndrome. I know you're very have a lot of experience in doing searches and finding very important information in the literature and assessing evidence and so forth. So that in and of itself would be a great contribution you could offer in this process and help in the devising of the methodology versus actually having the hands-on role, which we do hope that sometime in 2021 you'll be back in the saddle for that, as everybody in Arizona is in the saddle when they treat their patients, right?
It's the Wild West after all, right? All right. Well, I believe our time is up for today. We will have the recording of this available on the website either this afternoon or Monday afternoon. So, well, yes, we'll have it out soon. So if you have comments on that, that you can enter comments on the website in the discussion forum. Questions, we can continue this discussion there. So I hope everyone has a good rest of January, and we hope to see you at our episode 5 of Let's Talk About OMM Research. That will be February 19th, the same time. And we will be offering CME for that one. And we hope that you can join us. We're working on having someone come talk to us about using patient-reported outcomes in your clinic to help improve patient outcomes, patient health. So if that's not happening in February, it will happen in one of our future episodes. So we hope to see you then. Thanks.
Goodbye. Thanks for joining us.